Good evening, everyone, and welcome. My name is Sabrina Valvo, and I'm Director of Communications here at Ovarian Cancer Research Fund. Thank you all for joining us as we continue our webinar series this fall. Tonight's topic is nutrition for ovarian cancer survivors. Our entire webinar series has been supported by Genentech, and we want to thank them for their generosity in making this all possible. OCRF is the largest and oldest charity in the United States funding ovarian cancer research. Our mission is to fund scientific research that leads to more effective identification, treatment, and ultimately a cure for ovarian cancer. Since we awarded our first grants in 1998, we've invested nearly $60 million in research grants. Before we get started tonight, I have a few housekeeping notes for you. All listeners will be in listen-only mode throughout the presentation. We'll have some time for questions after the presentation, so if you think of a question as you're listening, please type it into the Q&A box you'll find on the right-hand corner of your screen. Nobody else will be able to see your questions that you ask, and no one else will be able to see anything but me. So I will select a few at the end and ask our presenter at the end of the presentation. There's no need to wait until the presentation is over to pose your questions. Just do them as we go along. I do ask that you keep your questions as general as possible so that the answers will be useful to everyone who's listening. I'm thrilled that Kara Anselmo, a nutritionist in New York City, is our presenter this evening. She's an outpatient dietitian at the Evelyn H. Lauder Breast Cancer Center and Memorial Sloan Kettering Cancer Center. Her special interests include oncology nutrition, plant-based diets, and weight management. Kara is also a certified yoga instructor and has taught group classes in New York City since 2007. Kara earned her Master of Science in Clinical Nutrition from New York University in 2007 and completed her dietetic internship at New York University Medical Center. She has a Bachelor of Arts from English at Brown University. We're very pleased to have you here this evening with us. Kara, I'll pass the mic to you.
Thank you so much, Sabrina, and thank you everyone for coming this evening. I'm just going to share my desktop with you all. Great.
Yeah, we see them.
Great. Thanks, Sabrina. So eating well can be a challenge for all of us, even in the best of times. And during and after treatment for ovarian cancer, it may be harder than ever. So this talk will go through some nutrition considerations and best practices for anyone who has had a diagnosis of ovarian cancer. One of my post-treatment patients recently said to me that there's a difference between surviving and living. It just so happens we were talking about eating chocolate. But this brought to mind two concepts for me, health versus well-being and how we define them. When we say health, we often mean the absence of disease or disability. Sometimes we equate health with improved survival. Measures to improve or maintain health might include exercising, staying at a healthy weight, brushing your teeth even, and wearing a seatbelt. Well-being might include the absence of disease, but to me it's much more comprehensive, and it includes quality of life, stress relief, and pleasure. So some measures are excellent for both health and well-being. For most people, going for a walk every day is great for both. It lowers the risk of certain medical conditions, it just plain feels good, boosts your mood, and improves energy. Whereas going to the dentist if you need a filling is important for your health, but maybe not as nice for your well-being. Survivorship, or as my patient would prefer to say, living after a cancer diagnosis, means balancing health and well-being. Nutrition is important to both. While a given diet can't cure cancer or guarantee the disease won't recur, smart eating can absolutely strengthen your body to help fight the disease, bolster your immune system, maximize the effects of treatment, add enjoyment to your life, and help you simply feel better. These are some of the reasons starting or continuing a balanced diet is important during and after cancer treatment. So what does a balanced diet look like? It's definitely not one size fits all. It's not only paleo or raw or vegan or macrobiotic. Every body is different and thrives on a slightly different diet composition. But for most people, an ideal diet has some common characteristics. So the first one you'll see here, it's mostly plant-based with an appropriate amount of calories and protein to maintain a healthy body weight and sufficient lean body muscle mass. It includes a variety of whole vegetables, fruits, grains, legumes, and healthy fats. It allows for body weight in an ideal range. More and more data suggests the ideal diet for weight loss and maintenance isn't so much about the exact percentage of carbs or fat or protein as much as being doable for any given individual over time, and avoiding excess amounts of any food. A balanced diet limits alcohol, red meat, and added sugars, and should not include processed meat like hot dogs or pepperoni. And perhaps most importantly, it's sustainable and it's long-term. It's a lifestyle. So following a balanced diet isn't the same as, quote-unquote, going on a diet. Different science and advocacy organizations set forth guidelines for cancer survivors. One large and highly reputable one is the American Institute for Cancer Research, or AICR. And you can access their website at aicr.org. You'll find that their recommendations are very similar to the points I discussed on the last slide. Now, sometimes simple says it best. A well-known quote from the food writer Michael Pollan covers all the bases with 3 little sentences. He says, "Eat food, not too much, mostly plants." Or almost all the bases. I would add that variety is also key, right? You could eat spinach and brown rice in moderate portions every single day, but if those were the only things you ate, your diet wouldn't be very helpful. Let's home in now on nutrition best practices specific to women who have or have had ovarian cancer. Unfortunately, this is such a limited area of research. We know very little about what women are eating after cancer diagnosis, how they might change their diets, and how diet might affect cancer recurrence, survival, and quality of life. Lots of important things. Most research to date on nutrition and ovarian cancer has focused on pre-diagnosis diet, so what women were eating before they developed ovarian cancer and how that might relate to outcomes. Some research shows that women who had a pre-diagnosis diet higher in vegetables and fruits and lower in red meat, processed meat, and milk may have improved survival after a diagnosis of epithelial ovarian cancer. And one study showed an association between higher intakes of plant compounds called flavanols and flavonones and greater survival. And these compounds are abundant in plant foods including apples and oranges, other citrus fruits, as well as green and black tea. It's very plausible, based on this information, that a plant-based diet is beneficial for women after diagnosis, even if we don't have studies yet to show such exact effects. An editorial in the Journal of the Academy of Nutrition and Dietetics recently pointed out that although healthful dietary patterns over time might not out and out prevent ovarian cancer, they may help to create a host environment in the body that's best equipped to fight the disease and respond well to any given treatment. Now, nutrition research is notoriously complex. The studies I'm talking about now are mostly observational, which means we can see associations between factors, but not cause and effect. So there's the proverbial chicken or the egg question. It's also important that in many nutrition studies, healthful dietary patterns correlate with other healthful lifestyle habits, including keeping an appropriate body weight, regular exercise, non-smoking, and not drinking excessive alcohol. Moving on to a couple of particularly hot topics in nutrition and cancer. So when talking about specific foods and cancer and recurrence risk, I often hear questions about sugar, like, does sugar feed cancer? It's a good question, and while there are lots of good reasons to limit added sugars in the diet, eating some foods that contain sugar won't in itself create cancer or cause a tumor to grow. Research does suggest an association between a metabolic condition known as insulin resistance and certain types of cancer growth. So usually our blood sugar goes up and down over the course of the day in response to what we eat, and the hormone insulin helps to regulate blood sugar. But when the pancreas continues to pump out insulin and the body becomes less sensitive to it, then blood sugar remains at a steady high state. Now, this insulin resistance is sometimes a precursor to type 2 diabetes, and it is more common in people who are overweight or obese. Eating a poor diet, including any foods excessively over time, can contribute to overweight, obesity, and insulin resistance. But moderate amounts of sugar in the context of a very balanced diet likely won't cause these conditions or cause cancer growth. Keep in mind that natural sources of sugar, like whole grains and fruits, are definitely preferable to added and concentrated sugars, for instance, those in sweetened beverages like sodas. I also hear lots of questions about soy foods and phytoestrogens and hormone-sensitive cancers, including ovarian, as well as endometrial and breast. Soy and some other plant compounds are called phytoestrogens or plant estrogens. Now, these compounds are similar in structure, but not identical to human estrogens. And to date, there's ample evidence that eating practical portions of whole soy foods, such as tofu or edamame, as you see on the left there, is probably beneficial and is certainly safe for women who have had a history of one of these types of cancers, as well as women who have not had a history of these cancers. There are no whole foods that need to be avoided completely because of concerns about phytoestrogens. Now, the research is less clear with supplements, with concentrated soy-based supplements, including soy isoflavone pills and powders. Based on the available evidence, I suggest avoiding these kinds of supplements or other potential phytoestrogens in highly concentrated forms, such as pills or powders or extracts. Let's now address some issues that are unique to women who have recently had cancer treatment. If you've undergone chemotherapy or radiation treatment, certain after effects can present extra challenges to eating well, as I'm sure many of you know. Always choose foods and beverages based on your own preferences and tolerances, while keeping in mind what's best for both your health and your well-being. For some individuals, gastrointestinal symptoms and side effects don't resolve as soon as treatment is finished. Our digestive systems are really sensitive and complex. Constipation is common, so be sure to hydrate well with water if that's the case. Increase fiber-rich foods. Physical activity is also helpful for bowel motility. On the other hand, if you have diarrhea, you do also need to hydrate well. You want to choose small, frequent meals and limit fiber-rich foods, as well as sugary foods and drinks like fruit juices, which can make diarrhea worse. Try to limit salty foods, fried foods, and carbonated drinks if you feel bloated and if you have heartburn. And if you feel nauseated, also try to avoid strong food odors. Usually cool, bland foods that don't have a very strong smell are best tolerated. Never force yourself to eat anything that tastes or smells unappealing. Taste changes may come and go over time. One thing that may taste funny is water. And if you find it hard to drink enough water, or if plain water just doesn't taste good, you can always try adding fresh cucumber or lemon slices for flavor, or try flavored seltzer. Fatigue can persist even well after active treatment is finished, and it can really affect food choices. Take advantage of simple preparation techniques and help from friends and family if you're too tired to cook or prepare food. Ask them for what you need. Order takeaway options that are plentiful in vegetables, whole grains, and lean proteins. Eat small amounts at a time and try to limit refined carbohydrates and added sugars, which can cause those dips and spikes in blood sugar and make you feel even more tired. Use caffeine judiciously and hydrate well always. Now, for a variety of reasons, you may have lost or gained weight during chemotherapy and radiation therapy, and I'll speak more about weight management shortly. After surgeries to remove the ovaries, reduced estrogen production may cause symptoms that influence food choices. For instance, you might find that if your mood is more labile, your eating isn't as mindful, or you tend to choose more comfort foods, or eat more or less than usual. Honor your body's own appetite signals, but do maintain some structure. Skipping meals or filling up on added sugars or caffeine might feel good in the moment, but we all know that can cause a crash later. Choose evenly spaced meals. Plan in advance as much as you can so that you have healthful options on hand, or you know what you can buy or bring if you're away from home. Also, regular exercise offers tremendous mental health benefits. physical activity can help improve mood, boost energy, improve sleep and cognitive function, and lessen anxiety. For some women, hot flashes make them want to choose more frozen treats like ice cream or cold sweet drinks. They can interfere with sleep, which affects mood, obviously, and energy level and weight, and many other factors. Interestingly, evidence suggests that if you're overweight, losing excess fat tissue can help improve hot flashes. And if you're carrying excess weight, losing weight can also help lessen joint pain. Physical activity can help with these symptoms too by improving range of motion and keeping the tissues surrounding the joints strong and pliable. Weight redistribution and abdominal weight gain may occur as the body's circulating estrogen decreases. Women who usually carry a little bit more in their hips and their thighs might find that the weight is now centered closer to the belly, which sometimes feels more noticeable or uncomfortable. Sadly, we can't spot reduced weight, but overall weight loss will still eventually lead to some reduction in these areas. If you did gain excess weight during or after treatment, don't beat yourself up and be assured that, yes, losing weight is difficult, but it is still possible. One of the best places to start is keeping a written food diary. Write down exactly what you eat and do it immediately after you've eaten with as much detail as possible. This is a tool to increase your own accountability and awareness of your food choices. It's not meant to shame you, and you never have to show it to anyone else. For many women, portion control is a critical factor in weight reduction. Even if you eat only healthy foods, it's possible to have too much of them. And this is especially important to keep in mind when eating out. Whether it's a sit-down restaurant or a quick-stop deli, chances are portions will be bigger than what you actually need. You can try eating half or 3/4 of your meal. And go slow. Your brain needs at least 20 minutes to recognize that your stomach is full. If you rush through a meal, you'll often end up overeating. Eat mindfully, paying attention to what you put in your mouth and why. Learn to read your body's own natural appetite and satiety cues. If you tend to eat when you're not physically hungry, and we all do sometimes, try to figure out why you're eating. If you're eating to soothe yourself, improve your mood, or feel less lonely, for instance, all common reasons, food probably won't help as much ultimately as doing something nice for yourself, like going for a walk outside or taking a nice bath, or seeking social support by calling a good friend. I have to laugh when I hear people give advice like, you need to lower your stress. It's easier said than done, right? Stress is a part of life, and we're all triggered in different ways. How we manage stress is more important than trying to get rid of it altogether. Use strategies that work for you. One tip is to get physical. If you can exercise regularly, stay in movement, you can help reduce negative effects of chronic and acute stress. Most of you have probably heard of BMI, which stands for Body Mass Index. It's a measure of weight based on height. Now, it's certainly not infallible for assessing an individual's health, but it is one tool that provides useful information. And when we look at big studies and large populations, BMI is actually quite reliably linked with disease risk. To calculate your BMI, you can divide your weight in kilograms by your height in meters squared. You can do this calculation at any one of a number of websites, including the NIH, National Institutes for Health, which is shown here, the CDC, Centers for Disease Control, Mayo Clinic, or again, the AICR website. You can also look at a BMI chart such as this one. I know that's a very full slide, which does the math for you. But look for your height in feet and inches on the left axis, and then go across to your weight in pounds along the same row, and from there go up to find your BMI. When using BMI as a reference, an ideal weight is defined as 18.5 to 24, overweight is 25 to 29, and obesity is classified as a BMI of 30 or more. Being at a healthy weight is about so much more than aesthetics or fitting into a particular clothing size. It's about both well-being and health, feeling good and also reducing disease risk. Overweight and obesity have been associated with diseases and conditions from joint pain and sleep apnea to diabetes, heart disease, and certain types of cancer. And there's strong evidence that overweight and obesity are associated with increased risk for cancers, including postmenopausal breast cancer, colon cancer, pancreatic cancer, and endometrial cancer. And furthermore, in breast cancer, we see that weight gain after diagnosis is associated with poorer outcomes and even an increased risk for recurrence. A report was issued by the American Institute for Cancer Research earlier this year based on data from 25 studies involving 4 million women, 16,000 of whom developed ovarian cancer. The research showed a 6% increased risk of ovarian cancer for every 5-point increase in BMI. Now, no studies have looked at weight gain or weight loss after ovarian cancer diagnosis, or weight and ovarian cancer recurrence risk. But given the available evidence, it's prudent to maintain or achieve an optimal body weight to the best of one's ability. Though some women experience undesired weight gain during and after treatment, conversely, some of you, I'm sure, struggle with unintentional weight loss. Particularly in metastatic and advanced stage cancer, it can be very hard to keep weight on. The disease state itself may contribute to weight loss, especially if symptoms have included any kind of abdominal distress or if the cancer has spread to other internal organs. Undesired weight loss can also result from treatment side effects. Some women have a loss of appetite during chemotherapy. Nausea, changes in taste perception, and mouth sores can absolutely result in less desire to eat and drink for some. Gastrointestinal side effects from chemo or radiation therapy, such as diarrhea, can contribute not only to decreased food intake, but also decreased nutrient absorption. And then stress and anxiety often very, very understandably underlie all of this. Mental health concerns are so often overlooked, unfortunately, but can cause undesired weight loss as much as any overt physical symptom. And fatigue also. We all deal, again, with stress and fatigue differently. Some people find that they eat more in an effort to self-soothe or try to stay awake, whereas others may feel too tired or upset to prepare or eat much of anything. Regaining weight can take time, so again, be patient with yourself. Sometimes it's best to set an immediate goal to simply maintain the weight you're at rather than put pressure on yourself to regain right away. Increase your food and beverage intake gradually, eating as frequently as is comfortable for you throughout the day, but small portions that don't feel overwhelming. Nutrient-dense drinks like homemade smoothies or shakes can add calories without making you feel really overfull. For instance, maybe try a smoothie made with almond milk, banana, honey, and some frozen berries. Choose foods that are your favorites, that you'll get some pleasure from eating, or at least that you don't hate. Don't force anything that doesn't sound appealing, doesn't smell good, or it doesn't taste okay. Try to incorporate foods that are high in calories. Now this is a change for many women who may have been in the habit of choosing low-calorie foods their whole lives, right? Don't be afraid now to have full-fat versus low-fat. Go ahead and eat nuts and nut butters, breads, extra butter, or olive oil to add calories. Switching gears a bit, I wanted to address the issue of dietary supplements because their use is so prevalent, and yet many patients don't talk with their healthcare providers about taking them. Half of U.S. adults take some kind of vitamin, mineral, botanical, or other dietary supplement, with increased use associated with having a higher education level and being a woman. Adults who have had a cancer diagnosis are even more likely than the general population to use dietary supplements. And some research suggests that 80% of women who have had an ovarian cancer diagnosis have used supplements. So really high numbers here. Because dietary supplements are unregulated before sale in the United States, they're a gamble. Unlike with foods or drugs, we just have no way of knowing that what's written on the label is what's actually in the product. Potential risks with supplements include contamination, interactions with other nutrients or medications, and getting certain bioactive substances in too great amounts. And just because a product or ingredient is natural doesn't mean it's safe. research actually shows worse outcomes with the use of certain dietary supplements. For instance, excess folic acid, vitamin E, and selenium in supplement form have all been associated with worse prognoses in adults with certain types of cancers. In some cases, as with fiber, for example, omega-3 fats and soy, we see benefits with incorporating the whole foods with these components, but no benefit, and sometimes even harm, with taking the concentrated or extracted dietary supplement forms. So have the form that nature intended. Eat the food itself. Before taking any dietary supplement, you'd need to weigh the potential risks and benefits, and in some cases we just don't have enough research to show clear benefits with a given supplement, but we also can't be sure of its safety, and when both safety and efficacy are questionable, it might be best to avoid taking a given supplement. Memorial Sloan Kettering's About Herbs website is an excellent resource for learning more about vitamin, mineral, botanical, and many other dietary supplements. There's also a free app, as shown here, which you can download to your smartphone. I believe this is only available for iPhones right now. As I mentioned earlier, there's a sad lack of published research looking at what dietary factors may be associated with improved prognosis for women who have had or are living with ovarian cancer. But I'd like to finish this talk on a hopeful note and tell you about a study being led at the University of Arizona Cancer Center. It's currently enrolling participants, and it promises to offer really valuable nutrition information. It's called LIVES, which stands for Lifestyle Intervention for Ovarian Cancer Enhanced Survival. And this study could potentially involve more than 1,000 women from 150 cancer centers nationwide. It'll be the first clinical trial to look at whether diet and exercise changes can affect recurrence risk, as well as their effects on quality of life and certain lab values. It's enrolling women who have previously received treatment for ovarian cancer, as well as fallopian tube or peritoneal cancers. And they will receive either general lifestyle coaching or counseling to follow a specific protocol of diet and exercise interventions. And to conclude, it's important to work with what we know in order to eat well with a diagnosis or a history of ovarian cancer. Do choose a diet that's mostly plant-based with a variety of whole foods and that promotes a healthy body weight. Manage symptoms proactively with food choices as much as you can, and engage in physical activity as much as you're able. Even though research is still limited, we're continuing to learn more and more about maintaining health and well-being after ovarian cancer. Thank you.
Thank you very much, Kara. We have time for some questions. As a reminder, you can submit them through the Q&A box. We already have a few that I'd like to start off with. You mentioned so much about sugar. Can you speak to sugar substitutes like agave and stevia and your thoughts on using those?
Absolutely. There are some sugar substitutes like agave and stevia that are more natural. Again, I hate to say that natural is safe, but that is one consideration. There is some research that using a lot of non-nutritive sweeteners, whether natural or artificial, can affect the body's own appetite and satiety cues and can affect glycemic response. So this is a very hot area of research right now. I would suggest limiting them, but if it's helpful for your weight management plan and you do include, for example, one artificially sweetened drink or one packet of Splenda in your coffee each day, as long as you keep it to moderate portions, it shouldn't be acutely harmful.
Great, thank you. You spoke a lot about sugar. I have some questions here about dairy consumption and ovarian cancer growth. Is there any studies or any information you have about dairy?
Yeah, there are some studies, and like I said, they were looking at pre-diagnosis diet, where they looked at women's diet before they ever had a diagnosis of ovarian cancer, and ones who consumed less dairy. And I say less because it's not that they weren't consuming any at all, tended to have better post-diagnosis outcomes. Now, one concern with dairy that I hear a lot is, what about the added antibiotics, the added growth hormones that are used in the production? And Yeah, absolutely. The industrialized agriculture practices that are used for much dairy in this country are abhorrent. So you can look for organic, you can look for dairy that's produced without the use of added antibiotics, added growth hormones, and for many women that makes them feel significantly better about choosing dairy products. But as with so many things, I would say it's more about moderation than elimination, and based on the research that we do have, the studies we do have, I don't think it's necessary to take it out entirely. I do think it's important not to overeat dairy foods.
Questions about protein. What type of protein is best for an ovarian cancer survivor? You spoke about phytoestrogens and soy proteins being safe, and nuts as well. Questions about, how much is too much protein, how much is too little, and what types of proteins are best?
Sure. The best thing to do is get your protein from a variety of sources. So I would encourage for most people, whether you're eating plants or animal or both, to change it up and maybe have tofu and soybeans one day, maybe have fish another day, and maybe have beans and legumes another day, and just make sure that you're incorporating all of these. I wouldn't say that there's one source that's better or worse. There are certain types of protein that are more bioavailable, but we're learning more and more that doesn't necessarily mean that they're better for the body in the long run. As far as how much protein, try to have a little bit of protein at every meal, every time you eat, so at least 3 times a day. And when I say a little bit, it really doesn't have to be huge quantities. Many Americans actually eat more protein than we need, and that's not good either. A rule of thumb, if you want a discrete number, is to look at your weight in kilograms, and that's the number of grams of protein per day, roughly, that you should aim to be getting. Now, again, for some women it's going to be more, for some women it's going to be less, but that's a rule of thumb that's often used.
You mentioned that a plant-based vegetarian diet is best. There's lots of questions here about the ketogenic diet and also about vegan, gluten-free, alkaline, pH balanced, macrobiotic, paleo. I think women are looking for recommendations on what you think might be best, not only while you're undergoing treatment, but also to prevent recurrence.
Mm-hmm. And again, all of those diet choices, there's it might be best for one individual, but I can't say that there's any research that one type is better in terms of risk of recurrence. Now, I do recommend plant-based because that's where we see the most evidence. And when I say plant-based, I don't mean that it has to be 100% plants, but that most of your plate at most meals is plant foods. Some people will interpret that as a vegan diet, and that's fine. Some people will say, no, I'd like to include fish and moderate portions of dairy, and that's fine as well. And that's where I really do believe that it depends on the individual and what you can sustain over time. As far as acid alkaline, there's a lot of talk about that. It's gotten very hot lately. You'll see lists of what to eat and what not to eat. There's a lot of myth involved with that too, and oftentimes those lists are good lists to follow, but there's also a tendency towards excess and extremism, and any diet in an extreme tends not to have the best outcomes. The ketogenic diet is very, very, very interesting, and for those of you who are not familiar with that, it's a diet that is essentially so low in carbohydrates that it is carbohydrate-free. It's very hard to do, as I'm sure you can imagine, especially if you're trying to gain weight, but it's thought that it might have some influence on cancer cell development. Now, the only studies that have really been done are in animals thus far, and we know from past experience that many times a study that's done in rats, the results don't translate to human beings. But it is promising, and I would just encourage people to keep an eye on it and look out for it, ask their dietitian about it, ask their doctor about it, because it might be appropriate for a given individual, but I can't make a sweeping recommendation that it's good for everyone or what settings it might be more or less appropriate in.
You did a great job of going over supplements to avoid and supplements to take. And there's a question here about your thoughts on vitamin C infusions for ovarian cancer patients. What are your thoughts on that?
Well, the thing to keep in mind with vitamin C infusions or any kind of infusions with these high antioxidant compounds is that, number one, there's a big difference between ingesting a food and having it go through the GI tract versus having it go directly into the circulation. Now, I'm not an expert in vitamin C infusions, but what I can say is that the dose of the vitamin C is important, and whether you're taking it in an infusion form or in a dietary supplement form, as with lots of things, we see that more isn't always better. And unfortunately, in some in vitro studies, we actually see tumor development and growth in an environment that's very rich in vitamin C. Now, that's an amount that you couldn't get from eating whole foods. You could eat all the oranges you wanted, and it wouldn't be too much. Your stomach would stop you before it was too much. But in the setting of supplements and infusions, we truly don't know how much is too much, and too much is definitely a possibility. So that might be a risk.
Here's our last question. It regards the products Ensure and Boost. During chemotherapy, some patients are advised to drink those products, and yet they found that some of the ingredients are ones that should be avoided. And I'm wondering what your thoughts are about how to get proper nutrients without, those types of drinks that are available.
That's a great question. I did mention that you can try making homemade smoothies, and that's my top choice. And that way you can put real foods in. And you can start with a base of, for example, almond milk or soy milk, and you can put in nut butters, you can put in fresh fruit. You could even put in some avocado or some silken tofu. You can get a lot of calories that way. And the calories that we drink don't really register as much as the calories that we eat in solid food form as far as filling us up. So using high-calorie liquids is a good solution. Now, if someone doesn't feel like they want to try making their own smoothies or they're just not available, there are some commercial smoothies on the market that you can buy. I would encourage getting something that is not raw, that is pasteurized if you're buying a commercial formula, particularly if you are getting chemotherapy or radiation therapy, because your immune system might be a little immunocompromised. There is another product on the market called Orgain. I've heard lots of patients say that they quite like that, and it does have some added sugars, but all of the ingredients are organic. And I think if you're choosing a commercial supplement and that's your concern is the quality of those ingredients, the Orgain might be a place to start.
I want to thank you so much for your presentation tonight, and thank you all for joining us this evening. Our final webinar for the year will take place on November 18th, when the chair of OCRF's Scientific Advisory Committee, Dr. Jeff Boyd, will speak and answer your questions about precision therapeutics and ovarian cancer. So stay tuned for more details on that. Please take a minute to fill out the survey that will appear on your screen at the conclusion of the webinar, as your feedback is very helpful to us. And for more information about OCRF, you can always visit our website at www.ocrf.org. Thank you all, and have a great evening.